It's the people and certainly the patients. Being involved in patient care has just been a wonderful experience, keeping me here for many years, knowing that you're contributing to treatment outcomes for our patients who are going through their treatment journey. Hi, I'm Paula Charuhas Macris. I am the Supervisor of Medical Nutrition Therapy Services, and I've worked here at Fred Hutch for 37 years. Nutrition plays a huge role in the whole transplant process. We know that if we can maintain our patients in good nutrition status, they will be able to withstand the effects of their treatment, their conditioning regimens, and any subsequent complications much better. When I first started, it was Eklund Hall, which was in the Columbia building, and the second floor was the transplant unit. I had 20 beds, and we would round each day with the team, multidisciplinary team, seeing every patient. So many of our patients were maintained on parenteral nutrition support. So this is essentially giving them intravenous nutrition. They all had central venous lines, and so it was an easy access to give patients nutrition. But in recent years, we've really changed how we're supporting our patients, and now are supporting them more through enteral nutrition or tube feedings, which has worked really well. It's more beneficial to the patient, providing them with luminal or gut nutrition. And I think we've really changed our practice, whereas we're not doing this 37 years ago. Things have changed so much now. We've gone to electronic charting. We have our laptops available to us when we're seeing patients or in patient rounds. We no longer have the laminar airflow rooms. It was found that they were really not that effective in preventing infection. So lots of changes, lots of good changes for the patients. More and better drug therapies so that perhaps they're having less gut symptoms early on, but we still have the big complication of graft versus host disease. Lots of good memories. There's still a few of us that are still working, still around from those early days. I had the privilege of working with a wonderful child who was from Virginia, and she came to transplant at the age of 6 with a very high-risk aggressive leukemia. Just a very, very delightful child who was really into crafts. And before she left, she made several of us Christmas tree ornaments that she gave out to the staff that had taken care of her. She went back home to Virginia and sadly did pass away, but I've kept that tree ornament and I've had it now for over 30 years, and so each time I put it up on my Christmas tree every year, I tend to remember her. Another fun memory was participating in a group that was featured at New Day Northwest, which is a program on King 5. And my colleague Carrie McMillan and I did a nutrition segment. Carrie talked about the role of the registered dietitian, and I was able to do a food demo with Margaret Larson, who was the MC or the host at the time. We made a salmon kale salad, and I was able to talk about plant-based diets and the benefits and good nutrition. And it was just a really fun experience to be able to do that. Being at the Hutch School was also great fun and a wonderful experience. Hutch Kids was a school, and sadly it's no longer in existence, but it was here for about 30 years. It was a school for the siblings and the children of patients who came here for treatment. And it was operated by Seattle Public School teachers, broken down into 3 grades, and it was located in what is now the Pete Gross House apartment complex. I was able to teach nutrition classes to the middle school kids, and some of the things that we did included lessons on calcium and protein, but we also did a field trip down to Whole Foods, and that was really a great experience because I was able to show the kids different fruits and vegetables, really unique ones, and the staff there was wonderful in the sense that they gave us good food samples and gave us a wonderful tour. So just exposing the kids to other maybe more unique fruits and vegetables and other foods. I think we're finding more and more evidence-based research on something called the gut microbiome, and the concept is that if we eat more plant-based diets, this helps to alter or diversify our gut microbiome, which now is really showing lots of good evidence that this can impact treatment modalities, immunotherapies, and even decrease the incidence of gut graft versus host disease. So lots of research going on worldwide, basically, as well as our center, and it'll be exciting to see how nutrition continues to play a role in that and really may impact the foods that we eat and how they can impact treatment outcome. Fred Hutch has been a wonderful place to work. The area of patient care really is a strong passion for me. Really enjoy working with patients as well as the relationships that I've made through colleagues here at Fred Hutch. I think everybody really has a warm heart to help our patients and compassion towards them.